Thank you, Janet. It's a pleasure to have Dr. Johnson back with us today. And our topic today is something that definitely is rather complicated. It seems like insurance of any kind is rather complicated. But Dr. Johnson, when we talk about insurance, it's always about premiums and deductibles and copays and what the insurance covers and what it doesn't cover. What do you think patients really need to know when it comes to vision insurance?
Well, that's a loaded question, right? But I think that people's understanding of insurance most of the time is about their major medical insurance plans, and all of us have to have that. The exorbitant cost of health care, everybody's trying to save as much money as they can, and employers providing health care insurance or our Obamacare plans that help provide people of all levels of income to have provisions in health care is very important. It's important for people to know what they're paying for. Are there options in their major medical general insurance, which might be a health savings account, in which that would be a tax-deductible account for them instead of paying pre-tax or after-tax dollars. They would pay, pre-tax. So that saves them some money. I think the main thing people need to know is they do need major medical coverage, and I know we're going to be talking about vision here, and vision insurance coverage most of the time is not rolled up into your major health care insurance plans. Sometimes it is, but vision insurance is usually a separate itemized expense in terms of cost to someone, whether they're working for a company or they obtain it through an exchange individually, privately. They just need to be able to know, because everything's so expensive, especially health care, where they're spending their money and how to save the most of the money that they can possibly save and get the best health care plan that they can get.
Now, specifically when it comes to vision insurance plans, of course, I know that they're all different, but in your experience as an optometrist, what are some of the shortcomings that you've seen with various vision insurance plans?
I think one of the main things is, as we discussed about your major medical plan, is that people don't truly understand what they're getting, because they would like something to help, pay towards their annual exams, and any glasses or contacts is the way they tend to look at getting or keeping their eyes healthy is, do I need new glasses? And we all know that's just a very small part of the equation. That the main thing is that they know they're not losing their vision, and which can only be determined by them having their eyes examined every year. So I think what people need to know is there are lots of different plans. Their companies usually elect which vision plan company that they're going to use, and that's going to be based on cost to the company and how much they charge their employee, and I'm sure they look at some of the benefits each one's provide, but usually it's going to be what helps the company save money if they're going to provide a vision plan for their employees and yet offer that as a perk. So the vision plans tend to cover, an eye exam maybe every year, and maybe they don't cover glasses every year, and so that's an expense. And so maybe they cover contacts. The patient may not wear contacts, but maybe the patient doesn't need any new glasses, but they are paying premiums for that. And sometimes, as we mentioned earlier on the major healthcare plans, they may be paying in that bundle package of health care, which they may not realize, actually a separate small premium or whatever the premium is for vision, which a lot of people, when they come in our office, when they've got major medical, they say, well, I don't have any vision. They don't mean they can't see, but they mean they don't have any vision insurance. And then we go always and look all that up for them, and we say, well, yeah, you do. You actually do have that through your Blue Cross insurance or your Aetna or Cigna, and they didn't know it. And they always, I think a big thing is everybody's confused. Well, what does it give me? What does it do? What do I get for this? I don't know. They just told me I had it at the office. They don't even know what they're paying for. And then usually they're thinking that, well, I guess my vision plan is going to cover me going to get my eyes examined. and get some glasses. Well, it's never going to cover all of that. And so people may be out of pocket more money having it with the premium and the additional fee past what the insurance allows than not having to pay for that, especially because people don't get glasses every year. They don't need new glasses every year, and some don't even wear glasses or contacts. So that's something that people need to do their math. The U.S. News and World Report has done several studies on this, and we've read these, and we know what people come in because we are eye care providers, and we know what questions the patients ask and what they're confused about. But U.S. News and World Report also did a study and said, do the math. In many cases, it's not worth your having the vision insurance. But most people, it's simple, it's easy. They've got it at work. I'll just pay this and I'll be done with it. If I got to go to the doctor, I've got it. It's not the same as health care. Health care, we know we can't take that risk because catastrophic things can happen, and you might have such a huge dollar expense that you couldn't afford to pay for that out of pocket. But your vision expenses usually are much lesser. And if you did have to have, like we treat a lot of glaucoma and macular disease, and definitely diagnose a lot of conditions like cataracts and treat pink eye and just overall infections in the body with different type of oral medications or topical. But those things are then covered by their major medical plan, but not their vision plans. And they don't realize that either. You can just see this expression on their face when you say, well, you've got this and this, but your vision plan doesn't cover an eye health problem or a surgical problem. So for those things, their major medical is going to take care of that anyway without a vision plan.
Dr. Johnson, you touched on this a little bit earlier, but can you go into detail about what flexible spending account funds are?
Yes, it's I think I referenced health savings account, or also known as flexible spending accounts. Those are dollars that if your company has that as a benefit or a provision, it's like a savings account that is for it's before you get taxed. So you just put it in kind of like a retirement plan, and you put it into this account, and it is approved by the government. But the monies in that account are only to be used for health care, which includes vision and teeth and going to see your doctor for any other health condition you might have. And so they can use those dollars, but they have to be designated that way. And many people, and it includes glasses, includes contacts, because contacts are the Food and Drug Administration's approval of a medical device, and people don't realize that either. But they can use those funds, and the beauty in that is they do have the money pre-tax to spend on that. So again, doing the math, like U.S. News and World Report said, aside from having a vision plan, if you have a health savings or a flexible spending account, if you do the math and you see, well, this is about how much I spend each year, if you've tracked that, and this is about how much a percentage I want to put in my paycheck, because this is how much, because it's pre-tax, I'm going to save myself. So not all companies have those provisions of health savings or flexible spending accounts, but if they do, it's a very good thing to take advantage of, because a lot of people will come in our office and they use that for their vision care and for their glasses if they want to get glasses. And a lot of them, they may wait because they want to see if there's any catastrophic illness that they might have. And if there's money left in it towards the end of the year, well, then they lose their money. The money's then taken by, I guess, indirectly the government.
Dr. Johnson, certainly we don't want to paint with a broad brush, but too broad a brush, that is. But when we're talking about vision plans, what about the restrictions that a lot of them have in regards to the materials that they dictate that are used when it comes to frames and lenses?
That's probably one of the most disconcerting factors about the vision plans that the consumer is, I won't say a victim of, but the consumer is not knowledgeable about that because their companies picked a certain plan. And we're not knocking having vision insurance here at all. I mean, it's very helpful to a lot of people. We just want people to make good decisions, but most of the time they don't know how to go about that because they don't do the math or even want to think about it, I guess. But as far as a lot of vision plans, like I said, it was very disconcerting to us, is that when they do come in, their plans are very complicated and they limit what type of frames or what type of lens materials, be it contacts or the quality of the lenses in their glasses, when we know there's a lot better, but we can't do that for them. Because then, and there's a bill right now up before Congress because so many vision plan companies are dictating what their employees can get, and it may not be the best quality lens to give them the best clarity, which is kind of foolish because they'd be more functional and more productive, I guess I should say, on their jobs the better they see, because the lens quality, whether it's a no-line type of bifocal or it's just the thinness of the type of lens design, there's a big difference in quality, but your consumer knows this. They know I wear contact lenses, I can see, I can't see. I like this brand, I don't. Contacts, they know a little bit more about brands. When it comes to lenses, they don't know, usually. They may have heard an ad about some particular type of coating or lens that darkens, but that's about all they know. And then they come in to ask us so we can further break that down and help them understand. But when it comes to the actual types of lens materials, if we just use the example as progressive lenses, well, people say, I want that no-line lens. I want that no-line. It's not a bifocal. I think it's a trifocal. And they're thinking, well, or they'll say, I've had one of those before. I can't wear those. What they don't realize, there's several hundred companies that make those, and all of them have different levels of quality and clarity. And so a lot of the vision plans only cover some of the lesser quality ones. So we're forced, when they use their plan, we tell them you can use your plan or you can get this on your own, but not too often do we do that because people are always trying to save money. But we try to make them aware this is the best lens that your plan will provide. And they'll say, well, I want the best that my vision plan will provide. So that's the unfortunate thing. But there is a bill I referred to earlier before Congress right now, and people should be able to get and see the best that they can see. And the vision plan companies also own their laboratories, many of them do, that manufacture the lenses, so that increases their profits. So then they dictate what lenses that people can get on their insurance programs, and then we're forced to use their labs when we could get a better lens doing it ourselves or using another lab that had better quality products. Again, we're not knocking vision plans because they do help a lot of people, and I think as you and I spoke earlier, they help a lot of people understand maybe the need that they need to have their eyes examined every year, because it does provide for that usually once a year, not necessarily a change in materials, but also the fact that, I need this because I've got kids now too, and it's going to be expensive if all 3 or 4 of us need glasses, so let me go ahead and take that out. And so it does at least get them in to have their eyes examined. So what's the importance of that? We said glasses are they're important for people to see and function, obviously. But since people tend to think if my glasses work and I can see, my eyes are fine, so I don't go till I can't, well, at least maybe the vision plan might make them a little bit more aware of the fact that I need to have my eyes examined each year. Or at least when they get here, we start to plant that seed. Think of your vision plan not as something that you have to come in and use and buy something. Use it to have your eye health examined so we can make sure you're not losing vision, because people may have a lot of health problems or may not even know they've got diabetes or hypertension, which we detect through the exam many times. And so then we send them out to get that treated as well. That can be affecting their vision and them not need glasses, or that can be affecting their vision, further complicating their need for glasses.
Dr. Johnson, what are some of the vision insurance plans that are accepted at Eyewear Gallery?
Well, we take Vision Service Plan, VSP. We take iMed. We take Davis. We take Blue Cross, Blue Shield. We take Advanica, A lot of St. Jude folks are on that. And there's more. All your major medical companies like your Blue Cross, your Cigna, your Aetna, CoreSource, HealthSource. Medicare does not provide for any glasses provisions, but a lot of the other that I mentioned in major medical plans, people aren't aware that they may have a vision plan benefit, not only in terms of an eye exam, but also in terms of maybe a benefit or coverage towards the cost of glasses. And sometimes those are great because the patients do get to pick what they want. We can give them the best product and they get a discount off of what that normally would be. That is the very best plan that we could be providing, or companies or anybody could be providing to the public, is more of a discount plan towards the expense of eye care and eyewears than to dictate materials and frames and lenses and how often they can get their lenses changed or how often they can use their benefit. They should just have a discount plan. They can use it as often as they need it. And then their major medical, when they have eye infections and problems that we can treat. And we are medical optometrists, so we do treat a lot of eye health conditions. We do a lot of digital imaging and some laser scanning, and we check the macular pigment density. And they're all really usually amazed by that, especially if they come in with a vision plan. You've asked for some names, but if they come in, they're just assuming, well, I'm just here to get some glasses or contacts, and what's my prescription? I would say 99% that's all they know. And then we really try to educate them, and so the best analogy we can give them is say, well, I know this seems silly, and glasses help you get up in the morning and go and do your thing, but you don't wait to brush your teeth until one falls out or hurts. So why would you wait till you couldn't see to think, I guess I need my eyes examined, or I'll take out my insurance, but I don't need to, my vision plan, and I don't need to use it until I can't see. If again, that's the mentality which we're really here to change, not only on this program, but here in the office. Myself and other doctors, all our staff are all well trained in this, is to help people understand that the only reason their glasses or contacts are working is that we keep a handle on whether or not their internal visual health or even the external, the front part of their eye, is staying healthy and good shape, and what we can do to, in a precautionary measure, to prevent that from declining so their glasses and contacts would work, much like you would brush your teeth so they don't fall out and you don't get cavities.
Finally, Dr. Johnson, where is Eyewear Gallery located? What's the phone number and what's the website?
For Eyewear Gallery, we're at 428 Perkins Extended, and that's near the intersection of Poplar and Perkins Extended, near the Laurelwood area. Well, I guess our hours vary a little bit. A couple of days we're here 8 till 5, couple 9 to 5. We're going to have an evening hour day per week as well, but we're open every Saturday, and we're open Saturdays 9 to 3, and that usually helps working people a lot. And our phone number is 901-763-2020. I didn't mention the website, but it's www.eyeweargallery.com. So it's www.eyeweargallery.com.
Thank you so much for being with us today. We've been speaking with Dr. Warren Johnson. That first name is Warren. He is a medical optometrist at Eyewear Gallery here in Memphis. This is Eye on Vision.